I do want to congratulate Paul and Margaret again. You've pulled it off. It's been a fantastic conference. I've been coming to this for over a decade and a half and love it every time. The second thing, so a round of applause for them. The second thing, during the first session this morning, I actually had a revelation. I'm on the advisory board for the HealthCare advisory board for the business school, and we're always trying to come up with new educational opportunities and even some business opportunities to generate some revenue. So I came up with a great idea. I think we should start doing half-day weekend sessions teaching blood pressure control to high school graduates. And I think given the provider shortage, that's going to be a win all around if we can pull that off. So you and I will go offline and talk about that after the conference today. And then I actually wanted to validate one of Dr. Steinhabel's premises. So how many people here know you're fat and inactive? No, don't feel compelled to answer. I'm sorry, that was a joke. But according to one of his slides, it is 1 out of every 3 of us. 35% of Americans are obese. So look to your left, look to your right. One of you is fat. Okay. So with that, let's move on to slightly more serious matters. I'm going to introduce our first speaker. Today's session is really the culmination of the entire conference, focusing on the strategic outlook in the healthcare market, and as everyone else has been over the last day and a half, looking at the impact of the ACA implementation. Our first speaker will be Chris Martin, who is president of the Precept Group. Chris brings over 25 years of consulting expertise to the healthcare and health insurance industry. His industry knowledge, professional creativity, and passion have contributed to Precept's industry-leading innovations in health insurance strategy, design, analytics, and employee engagement. Chris has adopted a radical ideology, which includes the belief that healthier, informed individuals enjoy better lives and have lower costs. Where the heck did you get that idea is what I want to know. I did not learn that in medical school, by the way, so thank you for that. Anyway, reflecting Chris's leadership, Precept was recently ranked 16th among the healthiest 100 workplaces in America, and that's impressive enough, but you realize that over 5,000 employers were surveyed for that honor. So with that, please help me welcome Chris Martin.
Good morning, everyone. Happy to be here. I'm a first-time attendee and a first-time speaker. So, I've been channeling yesterday my inner nerd, and today I've been channeling my inner geek. And I'm going to channel for you in a minute my inner art historian. But before I do that, we've heard from academics, we've heard from doctors, we've heard from economists, we've heard from technologists. Today I want to provide you some insights about how employers are thinking about the ACA and the impact it's having on their strategies and decisions. But as I mentioned, let's talk first about a little bit of art. So this is a picture of Le Bateau by Henri Matisse, and it was displayed in New York City's Museum of Modern Art in 1961. Over a course of about 50 days, 120,000 people went through to see this painting in the museum. And one day a stockbroker was out to lunch and decided to go to the museum and look at some art. And he made an observation about this piece of art, and that was it was hung upside down. And I think as employers think about healthcare reform in general, there's a lot of things that go unnoticed with them. There's specific things that are not transparent to them. There's specific things that are missing from their understanding of how this works. And the off-cited Kaiser Family Foundation, I think, hits upon this. So when you look, and this is just from January of 2013, or 2014, just a month ago, when you look at the individuals and what their understanding is of how healthcare reform is performing relative to their understanding, 46% of the respondents don't even know that there's financial subsidies tied to the ACA for them to go out and purchase insurance. More than half don't know that the ACA calls for an expansion of Medicaid into many of the states, which is how those folks who need subsidies would access their health care. And fully 53% of those didn't even know that pre-existing conditions were something that had been done away with through the ACA. So we're 4 years into this law. We're 4 years into this law, and we're still just getting to the basics of what it's designed to do. And employers are usually, or most typically, the place where their employees or these people are going to learn about this information. And so, like with this piece of art, things go unnoticed with healthcare. When you think about transparency and quality and cost of healthcare and how it's delivered, many employees and many members and patients have no real understanding of that. When you look at the data, and I think this is one of the positive attributes of the ACA, in that it is bringing more awareness about these things. But one of the things that we're seeing with employers, because of the shift to more skin in the game at the employee level and the dependent level, the people who are using these products, is that they're not even aware that the cost of an X-ray could be $30 at one location and $300 at another. So some of the things that we heard about earlier today, some of the technologies and solutions out there are really designed to create more awareness about these things. But by and large, the largest issue that's impacting the inflation of healthcare in America is really the lack of attention to lifestyle choices that people make that drive about 70% of the $2.5 trillion we spend in healthcare. And when you think why that's important to employers today insure about 162 million Americans. So they're fully providing insurance to 60% of those insured in America today, and they're financing about 50% of the cost. So this is a significant priority for employers, and let's get into more detail about that. Another thing when we talk about how these issues go unnoticed is, take a case in point of diabetes. Diabetes, 26 million Americans suffer from it. We spend about $1 in every $5 on treating diabetes, seventh leading cause of death in America, third in the world. There's about 80 million Americans who are pre-diabetic or don't know that they're going to be diabetic. 7 million are undiagnosed right now. And as it relates to how you begin to bend the cost of healthcare, one of the things to do is to get more engagement and to drive more compliance with evidence-based medicine. And this says that there's about 40% of those diabetics out there who aren't getting the care that they need to treat this condition. And this is problematic across a number of different health conditions. The hypertension issue was addressed earlier today with the noncompliance there. So employers are becoming increasingly interested in how they begin to address greater compliance within their workforce about addressing these things. So in a post-ACA environment, these are the things that employers are thinking about. Their first, most short-term objective is, what do I need to do to be compliant with the law? Following that, they begin to think about, what are the strategic opportunities that I could take advantage of? What are the things I could do to either mitigate the cost associated with PPACA, or what are the things that I could do to better address impacting healthcare trend for my organization? And as I mentioned, employees are coming to them to understand how the law impacts them. And so that's typically the one location that they go to find out more about how the healthcare law impacts them individually. And because of that, employers are looking to better educate their employees about the ACA. They're looking for tools that allow them to do that in a more efficient and effective way. And they're looking for the right resources externally that can help them with that issue as well. So these are the three top-of-the-mind priorities as it relates to complying with the ACA. This is just some statistical data, and I think this was well covered yesterday, but I'm not going to go through all the numbers, but some that are sort of notable to look at are just the number of workplace hits. And within my organization, I think we could account for a pretty big number of those. Even though we weren't shopping for insurance, we certainly wanted to understand what that looked like in the marketplace. But today, there's probably somewhere in the range, and this is HHS data that was published on last month, there's probably about 2 million people who have selected marketplace insurance, and this is the breakdown. And again, as employers begin to think about the risk of this and what it means and what it portends for costs going forward, there's concerns about some of this information. The target of having 18 to 34-year-olds be a significant percentage of those enrolled in the exchange and enrolling in healthcare, we're far below that number. And so what the employers are asking their consultants is, well, what does this mean in terms of the pressure this is going to put on prices going forward? This is a representation of the money that's being raised to finance healthcare reform. So there's about $437 billion over 10 years of fees, taxes, and other things that are going to be collected. The reason I circled some of these is most of these are falling on the employer and the employee and the taxpayer to fund. And so when you think about that, these costs are being essentially passed on, even though they apply to certain other people that are the delivers of these consumer solutions and services. Most of them end up being financed in healthcare premiums by the employer. I like to divide big numbers, and I really couldn't do very well with this, but when I just began to look at the $437 billion and think about if I divided that by the number of people that they're trying to insure with this 30 million, it comes out to about $14 million a person over 10 years, which I didn't know that didn't make a lot of sense to me because we're doing a lot better job managing cost than that. So revenue, fees, and taxes are concerned for the employer and how that'll translate to them. The whole idea of supply and demand with the reimbursement cuts to Medicare, when we looked at over time at the impact on employer cost increases as it relates to how Medicare is financed and how Medicare and Medicaid is financed and what providers get paid, there's been a significant shift to the private payers, and historically that's been in the range of about 15%. So on a dollar claim, employers are being surcharged about 15 cents on that dollar claim for the lack of reimbursement that providers see coming from Medicare and Medicaid. With 30 more million people seeking insurance, employers do the basic economics of that, which is we have significant demand for health care that's going to be increasing with more insureds and aging baby boomers, but we have a limited supply. And so the basic way that you interpret that is that more demand, fewer supply equates to higher cost over time. So it's a significant thing that employers are thinking about. And employers, for the past decade, I'd say larger employers in particular have been very interested in the productivity and health of their people, and so they're looking for more innovative ways to drive risk management of their employee-independent population within which they insure. So I mentioned where the numbers come from, and the issue is that for most part, and I think McKinsey is supporting this, most employers intend to continue offering insurance to their employees as long as it's a tax-deductible expense for them. It's an important part of their attraction and retention strategies. So I like to think you could really write on the top of a napkin what employers think about these things. And when you think about employers and what they're trying to do to drive their business success, it really comes down to these three things. They want to have meaningful use of their company assets. They want to minimize financial risk. They want to generate profits. They want a high-performing culture. They want their people to perform and motivate. They use these types of things to attract and retain a quality workforce. And they're improved in the health, and they're invested in improving the health and wellness of their employees. The challenges they have to help execute that is really that the current course is unsustainable to them. They've been looking at double-digit increases over a number of years, and those don't seem to be, from their perspective, diminishing in any way. They believe that a lack of information, a lack of alignment with the other key stakeholders that are providing care to their folks, i.e. Health systems and health plans, are not aligned with what their objectives are. And they recognize if they don't begin to address these issues with behavior change within the labor force, that it's only going to get worse. So historically, what employers have done to deal with healthcare cost increases is typically focused on these basic customary strategies, which is they'll get a renewal, they'll react, they'll look at the plan design, they'll look at the cost sharing between them and their people. They may go out and look at an alternative vendor. Maybe they look at Kaiser versus Anthem or Cigna versus UHC. And they may also consider funding the risk differently, just like you do with your auto insurance, where you look at what they're charging you. Maybe you consider a higher deductible. They're interested in participating in risk as a way to mitigate that. Where they're going is now more towards this direction of looking at trying to create more consumerism to educate their people to be better users of health care, or better consumers of healthcare versus users of healthcare. They're getting them to invest more of their own money in the transaction, meaning they're looking at things like high deductible health plans, and we're seeing a pretty significant adoption of high deductible health plans and HSAs faster than we saw with 401k plans when this same type of event happened with defined benefit programs 20 or 30 years ago. They're looking to get access to more data and integrate it, the interoperability that was discussed. And they're really, frankly, trying to get involved in optimizing medical and health outcomes. So how do I get that person to get the MRI at the $400 solution center versus the $4,000 solution center? Those are the things that they're interested in looking at, and those are the actions that they're taking. So I mentioned one of the basic strategies is to look at funding, and this is just an example of looking at a 1,000-member or 1,000-employee company and what the cost would look like in a fully insured setting versus in a self-insured setting where they would buy a high deductible and take some risk themselves. And because these programs are managed by state-mandated issues, and these are more ERISA-based, meaning the federal government drives compliance with these, you get some instant cost savings even outside of the ACA by thinking about taking risk. And what many health insurers are now doing is they're bringing these types of solutions down to very small employer sets, where typically when you look at large employers, almost 100% of them are self-funded in some way. Many of the smaller ones are now thinking of this as a strategy to do that. When you then think about how that impacts the ACA, you can eliminate a significant amount of this insurance premium tax by moving to a self-funded environment, because now you're only paying premium tax on your stop-loss insurance or your high deductible versus all the premium that you pay. So thinking of a solution that's really not a next-generation solution, but more of a solution that's in place that's going to come downstream to employers, there's almost a 10% savings to look at this as a methodology for funding risk. So what does it mean if you move from this environment to this environment? And basically what it means is that you need to have more information, you're taking on risk, you need more analytics, you need more data to look at, and you need to do a better job managing it because now you own a significant portion of the risk versus the health insurer. And I heard Clayton Christensen mentioned earlier, and I took his sophisticated drawing and put it into a napkin format. And why employers are doing this is when you think about the stakeholders in the healthcare equation, governments, employees, employers, employees could be classified as patients, health systems, and health plans. And you think about what are the ingredients or what are the things that are necessary to get people to change. You have to be able to connect and know the individual very closely. You have to be able to look at information and act decisively with that information. And you basically have to profit from wellness. And so Clayton Christensen said, when you look at all the key stakeholders, the one who seems to have the most motivation and the best ability to execute a strategy like this is the employer. Thank you. Wow, that went fast. So big data and analytics, and we heard a lot about that earlier, are technologies and solutions employers are deploying to make this happen. So they're looking at how do I identify risk within my self-funded population, and how do I then mine that data to do things that are very specific and intentional around getting people to behave differently. And what they're then doing is they're tying incentives, which are the real tipping point to get people to change behaviors. And incentives today are primarily in the form of carrots, meaning I'll pay you to go do something, but they're quickly going to translate, as we heard earlier, into a more personalized approach, meaning I have to earn a certain number of, call it frequent flyer miles, or I have to have a healthcare FICO score. That means I'm going to get better pricing and better solutions and lower costs when I access healthcare going forward. And literally everybody within the continuum of healthcare needs, meaning somebody catastrophically ill all the way down to somebody who's very healthy, can be engaged in this way, and they can all be put on their own personal journey towards improving health. Case in point here is data that we mined for a local Orange County employer with about 12,000 employees. What we did is we looked at all of their raw claim data information, and we identified that we had about 1,156 members within the population over age 50 who hadn't had a colorectal screening. We had about 855 women who hadn't had a pap smear in 24 months and 329 women who hadn't had a mammogram. So these are the people that aren't entering the healthcare system. They're the people who are deferring the consequences. We also had about 2,300 care gaps. So we mined the data to say, do we have diabetics who haven't had an A1C? Do we have diabetics who aren't filling their prescriptions? Do we have hypertension patients who aren't taking their medication to manage that condition? And what this employer did was they used mobile technology to ping very specific information to that end user with an incentive tied to it to get them to go to address that. So what we're finding is that when we look at the baseline things that people use to manage these things, and you look at case management, which is typically delivered by health plans to work with the most catastrophically ill, condition management, which are more commonly referred to as disease management programs and other types of things, when we find employers using incentives, using personalized information to connect with their people, our engagement results are significantly higher. And what that is leading to is a significant reduction in the health risks. When you look at the things that people are doing that are driving poor health, we're seeing significant reductions because of the financial motivation and the ability to give information to these people that they can act on a personal basis. The most recent one of the accounts that we looked at saw almost a $9.50 to $1 ROI. And ROI is a big consideration for employers. They're very interested in what these things cost. And recently Rand did a study that said, you know, wellness programs haven't really done much to deliver a positive ROI, but this idea of population health management, meaning going after where all the cost is, those 20% who are incurring 80% of the claims expenses, is very effective. So these are the things we see employers doing, offering those incentives, looking at moving potentially to a Safeway type program. And these employers are the ones that are seeing better than CPI cost increases right now. They're holding the line on healthcare trend. It's a very effective approach. And just sort of in summary, I could have used one slide, but I couldn't bring myself to do that. Employers effectively see these major transformations happening in healthcare. So a move from fee-for-service to pay-for-performance, a move from unengaged consumer to a fully engaged consumer, and a big adoption of technology about running these things. And the key punchline here is employers typically have sat outside of this arrangement between health plans and health systems. But what they're doing is they're trying to engage in this using technology and systems to drive people back into the health system. And when you think about how these stakeholders align, they do have something in common. And whether it's a member for a health plan, an employee or dependent for an employer, or a patient that sits where these three circles converge, there's a common thing that people want to be managing there. So I think I finished a minute early. 30 seconds. Perfect. 30 seconds early.